Hello and welcome to South First, where we narrate the other half of India's. With the World Health Organization declaring the monkeypox virus a public health emergency of international concern, we are now dealing with two viral diseases at a time, COVID-19 and monkeypox. Also, detection of wild-type polio virus in Africa and US suggesting re-emergence of more such pathogens. To discuss concerns around this, how important is pandemic preparedness, COVID situation, and much more, we have with us Dr. Gagandeep Kang, renowned microbiologist from CMC Vellore. Thank you for your time, Dr. Kang. 4 cases of monkeypox reported now in India. 3 from Kerala had international travel history. Person from Delhi has no international travel history, indicating human-to-human transmission within the country. Should we be worried?
Well, anytime you have a new disease coming into a population, it is a matter of concern. But I think it's also important to remember that this is a disease that is only in about 17,000 people worldwide at the moment outside of Africa. And it is a disease that can be controlled with public health measures, early detection and isolation of individuals. It also has a mode of spread that is very much more limited than SARS-CoV-2. So therefore, if we are aware and we have the facilities to get a diagnosis made quickly, we don't really need to worry so much. It is painful for the people who are infected. They do get quite sick, but case fatality rates are low. It's self-limiting. Recovery happens in 2 to 3 weeks.
So something about the virus in itself, like is the transmission of this virus happening differently in different populations?
So this is a virus that in Africa is frequently transmitted from animals to humans. And it can be through prolonged contact with an infected animal, or it can be through eating infected animals' meat. In terms of human-to-human transmission, the primary mode of transmission is skin-to-skin contact, and another way that people can get infected is through the respiratory route, but that requires fairly prolonged face-to-face interactions for a long-ish period of time before you acquire the infection. So mostly skin-to-skin contact is the way that people get infected.
Okay. So I just want to understand, can a newer variant of concern of SARS-CoV-2 emerge with interaction of two viruses? We have two going on simultaneously. Can a newer variant of concern emerge that way?
Monkeypox is a DNA virus, SARS-CoV-2 is an RNA virus. Those two are not going to create a hybrid virus.
Okay, that's some positive news, some relief to understand that, yeah. So I also want to understand now that we know that there are two different viruses, but is COVID-19 making the monkeypox outbreak worse? As in, no. Is it bringing down our immunity? Is there any role which COVID is playing?
No, but the other virus that can lead to greater severity of infection, particularly for monkeypox, is HIV, where if you have a compromised immune system, if your HIV is not well controlled by medication, then you might have very severe monkeypox disease and die. But this is, of course, in a very limited number of people in whom HIV is not well controlled.
So does this call for NACO's interference immediately and do something about it?
So I think obviously NACO should continue to provide antiretroviral therapy to all people to whom it has been providing therapy without interruptions, because we don't want them to not be well controlled. But in terms of the monkeypox itself, what's really required is to increase our capacity to be able to diagnose cases, so laboratory capacity, but also clinical capacity, so that people learn how to recognize cases. You know, when you say fever with rash, fever and rash can occur in many viral infections. So fever that is followed by rash that then becomes like blisters, then becomes like pustules, then develops a little depression in the top. Those are characteristics of a monkeypox infection, of pox infections in general. And we haven't seen pox infections in a long time. So people need to learn how to recognize that and make sure that if they are suspicious that they have this infection, that they get themselves to a place where they can be diagnosed and, if necessary, managed. Most monkeypox infections can be managed by isolation at home. They will not necessarily require hospitalization if you can isolate appropriately at home. So it's important to remember that.
How important is the 3 T's here, the test, track, and treat, what we have learned from COVID?
Well, testing and tracing are very, very important here to be able to make a diagnosis and then to be able to identify contacts that an infected person might have had, so that you can make sure that you follow up the contacts for the period of incubation. And if any person is found to be infected, then again, make sure that their contacts are also followed up and isolation or quarantine are appropriately implemented.
Okay. So now coming back to WHO's declaring this as a public health emergency of international concern, this is a resurgent disease. What is leading to these viral disease outbreaks?
Well, you can make the argument that seeing an increase in viral infections in humans is really 2 reasons. One, that we have upset our environment so much that we are acquiring viral infections from species with whom we would not normally have come in contact. The second may be a bias of increased detection because we have increased awareness. So therefore, we are identifying something that may have gone under the radar previously. With monkeypox in particular, what is a hot topic of discussion is why are we now seeing so much monkeypox, right? It's a disease that's been in Central and West Africa for the last 50 years. There have been cases, very small numbers of outbreaks. Suddenly, how did it get so big? Is this a virus that has actually been circulating in humans for a while and we are just able to better identify it now? Did it adapt in animals and then make the jump into humans so that the new has the ability to spread from human to human much better than we had before? So these are things that still require investigation, and it will require, as for any other viral infection, a combination of epidemiology that actually tracks patients and their contacts to look at spread of disease, as well as genetic or genomic epidemiology, where you can track the strains along with the illness that they produced.
So does this mutate like SARS-CoV-2? I mean, does the same methodology follow here?
Well, in general, DNA viruses don't mutate as much as RNA viruses. SARS-CoV-2 is an RNA virus. Here we are dealing with a DNA virus. It's actually quite interesting that in the viruses, the monkeypox viruses that have been sequenced, there have been since 2017, 2018, about 47 mutations identified, of which 42 are very similar sorts of mutations in a family of human proteins called ApoBec3, which are involved in antiviral immunity. Now, this has been discussed and described by Andrew Rambaud. And there are others who have also been looking at sequence data that say that the importance that is being assigned to these mutations does not hold true in the sequences that they have examined. So there isn't really, the Rambaud theory is that this is a virus that has actually been circulating undetected in humans for at least 5 years. And there are others that have looked at the data and said that we don't think that that is the case.
Okay. So while we are yet to understand this whole, the virus itself, how in India are we looking at emergence and re-emergence of infectious diseases?
So I think building pandemic preparedness, epidemic preparedness is absolutely critical. What tends to happen with us is when we have an emergency, we devote a lot of time, effort, resources to that emergency. There's Zika, let's do Zika. There's SARS-CoV-2, let's do SARS-CoV-2. There's H1N1. Today we are doing H1N1. Monkeypox has arrived, so all the focus is on monkeypox. But really what we need is stable surveillance systems that are constantly improving, both in their ability to collect samples, but also in the range of pathogens that they detect. So the baseline must be something that we keep over time, even as we make sure that the breadth and the reach of what we are doing continues to expand. That requires resources. That does not require this, let's start again for something else, stop kind of mechanisms that we've had in the past.
So coming back to COVID-19, how are southern states faring? Are we seeing positivity? I mean, we are seeing positivity rates going up in some of the districts, and then, it's drastically coming down, but our testing numbers are also very low. So where do we actually stand in terms of COVID-19 situation?
Look around you, what's happening in the hospitals. That's really the most important thing, given that the bulk of our population has been both vaccinated and infected. I think by and large, in the absence of a new variant that can overcome all the immunity that we have so far, we are in a really pretty good place. It doesn't mean that people will not get infected, that people will not get sick. Some people can be quite miserable for a few days, and then they can be long-lasting effects. It's not something to be taken lightly, but it's not something where we should expect to see the kind of situation that we saw in April and May of last year, where we had hospitals being full, the oxygen requirements, the high mortality, etc. That's not going to happen without a new variant.
Okay. In terms of vaccination for monkeypox, where do we stand? Should everybody take the vaccine? Now EU has approved.
No. Everybody should not take the vaccine. There are some groups that are at particularly high risk. So people who work with pox viruses, people who are healthcare providers who might be looking after patients who have these infections, people who are particularly at high risk of acquiring the infection. For example, right now, 9 out of 10 cases at least that we are seeing are in men who have sex with men. And if we can protect that population, then we actually stop the spread of disease in its tracks. This is not a sexually transmitted disease. This is largely a disease that is transmitted by skin-to-skin contact. But vaccinating people who might potentially acquire this infection helps to protect them and helps to protect the community. And we need to be aware that there shouldn't be any stigmatization, but there should be a recognition of epidemiological principles when we decide whom to vaccinate.
Thank you so much for your time, Dr. Kang. It was really wonderful talking to you. Thank you very much. That is all we have for today. See you soon.